was very ill and called me this morning at 6:30 with 102 fever. And she just does such a terrific job. So it was a scramble this morning to get everything where it's supposed to be. She usually comes in at 7 o'clock, and that's the final things that she does before committee. So I appreciate everyone that stepped in, to Elizabeth and others who stepped in to finalize the agenda. Before we begin with the reviser's memorandum brief, I just want to mention that we do have 2 proponent oral testimony. We have lots of written testimony, more that haven't even been downloaded yet. And then we have 4 oral opponents. And because I like to give both sides the same amount of time, both sides will have 16 minutes. So the oral proponents will each have 4. And I don't imagine that the oral proponents are going to need 8 minutes each, but they are allotted that should they need it. Okay, would you give us our brief, Jen, if you're ready?
Thank you, Madam Chair. Good morning, members of the committee. Jenna Moyer, Reviser of Statutes Office, and this is Senate Bill 29. If it looks familiar, that's because it is a carbon copy of Senate Bill 391 from last year. So if this bill brief also sounds familiar, it's because all I did was change the dates and the name of the bill, or the number of the bill. So Senate Bill 29 restricts the authority of the Secretary of Health and Environment and local health officers to prevent the spread and introduction of infectious or contagious diseases, and repeals the authority of the Secretary to quarantine individuals and impose associated penalties. Section 1 names the changes to omitted statutes as the Constitutional Right to Health Freedom Act. Section 2 removes the authority of the Secretary to adopt rules and regulations to carry out the provisions of subsection A, and adds a new subsection C to KSA 65-101 that specifies that the Secretary of Health and Environment shall not carry out their duties in this section in a way that conflicts with other statutes or expands their authority. Section 3, beginning on page 2 in KSA 65-116G, amends that section by setting out that violations of the act related to tuberculosis are unlawful, and sets out that penalty as a Class C non-person misdemeanor. Section 4, also on page 3, amends KSA 65-118, and it strikes teachers and school administrators from the list of people required to report to the county or joint board of health or the local health officer known cases of reportable infectious or contagious diseases. Section 5, which begins on the top of page 4, amends KSA 65-119, and it strikes the county or joint board or health or local officer from having the authority to prohibit public gatherings when necessary for the control of infectious or contagious diseases. Section 6 is also on page 4, and it amends KSA 65-128, and it eliminates the authority of the Secretary of Health and Environment to designate infectious or contagious diseases by rules and regulations, and instead requires the Secretary to submit a report of those diseases to the legislature. So there's currently a rule and regulation that lists out all the infectious or contagious diseases, a report of which sets off the KDHE response, and under this bill, that rule and reg would be gone. So subsection B eliminates the authority of the Secretary to issue orders and adopt rules and regulations to prevent the spread and dissemination of diseases, including testing and isolation, and instead allows the Secretary to recommend and educate the public. Section 7 amends KSA 65-129 and strikes all references to the Secretary's authority to order an individual exposed to or capable of transmitting an infectious or contagious disease to seek treatment or quarantine. It would take away the authority of local health officers from ordering treatment or quarantine to just being able to recommend treatment or quarantine, and also strikes the authority of a local health officer or the Secretary to order law enforcement to assist in execution or enforcement of orders under this section. Section 8, beginning on page 5 at the bottom there, amends KSA 65-129D, and it prohibits employers from discharging an employee because that employee is following a recommendation of isolation or quarantine, and it also adds a civil cause of action against that employer. Section 9 amends KSA 65-202, which are the duties of local health officers. It strikes the authority of the Secretary to require local officers to perform duties and eliminates the authority of a local health officer to issue orders regarding remediation of any infectious disease. Section 10 amends KSA 672, 5180, and it strikes references, strikes language, referencing the secretary's authority to order school closures. And then Section 10, and the bill would also repeal KSA 65126, which is a secretary's quarantine authority, 65127, fines for violations of certain health statutes, 65129, criminal penalties for violating quarantine, and 65129C, which is local health officer or secretary isolation and quarantine procedures. And I'll be happy to answer questions.
Thank you. Any questions for Jenna? Yes. And by the way, those in the room, just want to mention that we have several of our members that are on WebEx today, as you can see. Senator Petty.
Jenna, on this section on page 7 that you just mentioned about schools, so then could a school no longer, if a child comes to school, they have measles, could they no longer ask a parent to come pick them up or ask them to be removed from school? I'm not sure of that.
Thank you, Madam Chair. Senator, that is a separate statute, which is not amended by this section. A school would still be allowed to send a sick kiddo home. That authority to open or close schools would remain with the school district, not with the secretary or health officers.
All right, thank you. I do have another question. Jenna, on page 5, could an employer, can an employer then, if a person has TB, can they tell them they can't come to work?
Thank you, Madam Chair. There is nothing in this bill that changes the control that an employer has over keeping their workplace safe in Kansas' right to work state. So they would have the authority to kind of set the parameters of an employee's employment. So what this statute amends is it says that if an employee chooses to follow a quarantine or isolation recommendation, you can't get fired for following that recommendation.
You can't get fired. So what, on the top of page 6, about that refers then if the employer chooses at the top of the page when it says follows an isolation or?
Yes, so a public or private employer shall not discharge an employee solely or an immediate family member for following the isolation or quarantine recommendation.
Thank you.
And Jenna, if I may, to clarify, so what you're saying is if they're, like, we'll use tuberculosis since we have had an outbreak of that in Kansas, and there is a rule that you need to quarantine or you need to be able to stay home. An employer cannot fire someone for, like, you're not coming to work, forget this requirement that you need to stay home. I can't see that happening, but they cannot be fired if they're following that rule, correct?
Following the recommendation.
The recommendation.
From the local health officer or the secretary,
Okay,
yes.
thank you. Yes.
Jen, I just have one other question. On page 3, I was just curious as to why in line 13, the code of federal after 41, why that was struck?
That is just an update. We use CFR instead of Code of Federal Regulations.
Okay, thank you.
Just a technical update.
Also, Jenna, this bill, you were saying it's the same bill that came before the committee, but not the bill that was passed out of committee because there were multiple amendments, if I remember.
Yes, there were amendments. So this was the bill as introduced last year.
As introduced.
For updating years and such.
All right, thank you, Senator Blasey.
Thank you, Madam Chair. Going back to Section 8, it's current law that it's unlawful for an employer to terminate an employee for following or I guess abiding by current isolation orders. Isn't that correct? Isn't that current law? And this change is just to open a cause of action against an employer?
Yes, so the current law is if you're under an order for isolation and quarantine, you cannot fire that person. And then because the local health officers and secretaries cannot issue orders for isolation and quarantine anymore, the language is updated to specify it would be following the recommendation. And then it does add that civil action.
Thank you.
Committee, other questions for Jenna before we move into testimony? Seeing none? We will start with the oral proponent testimony, and we'll begin with Melissa Campbell.
Hi, good morning. I'm Melissa Campbell. Nice to see you all again. Today I'm asking you to support SB 29 as it is written. I believe that we should be able to feel safe in our own homes, and I don't need an unelected bureaucrat, certainly one who is not a medical doctor, trying to order the sheriff to remove me from my home because I have chosen not to receive a treatment that they think I need or a vaccine that they think I need. SB 29 is really essential to reflect the will of the people. I wanted to give you a brief history on Chapter 65, 129B and that section, how it came to be. And back in 2005, the House Appropriations Committee actually gave the appointment powers to the KDHE secretary. And so it's House Appropriations, they passed it out. It went through the House floor and was passed over to the Senate. It went through the Senate Ways and Means Committee and passed out without amendment, still giving the KDHE secretary appointment power. But then when it went to the Senate floor, it was suddenly had a huge balloon amendment added to it. And it went on that the KDHE secretary now had the quarantine powers and the all sorts of powers that were not originally granted, quarantining and removing people from their homes. And so it went out and became law. The House concurred with that modification, and it became law, and it has been there for 2 decades now. In 2022, she mentioned that we've had this similar language before. We actually had the Johnson County Sheriff's Department as well as the Kansas Sheriff's Association testify saying that they did want this sheriff's portion removed. They firmly believe that law enforcement is to be keeping law and order and peace in the communities. And so when they are participating in what they consider to be a Fourth Amendment violation, unlawful search and seizure. They don't want to participate in that and wholly disagree with it being in statute as it stands. So we really don't want this to be standing anymore. The scope of government really needs to be reduced instead of trying to obstruct citizens' lives and their livelihoods. Kansas legislative processes, they give citizens the opportunity to kind of share their support for a bill or their concern for any kind of proposed law. Because the citizens didn't get a share 20 years ago, I think we should carefully be weighing this, the thoughts and testimonies of our citizens today. As she said, it's been run a few times before, and all we've had on our proponent side is citizen after citizen after citizen saying, please support this bill. We want to move this out. We want to have protection in our homes. We don't want to have the fear that we're going to be removed from our homes. And the ones who oppose it are big business. They're big money, big companies, and organizations that are not actually standing for the people. Our government is to be run by we the people. And so I feel like the bias of the constituents who are testifying and writing, and I think large numbers of people have written in, we want the opportunity to be heard and for our opinion to be valued above the organizations. So to be clear, the big money organizations, they don't represent the will of the people. The proponents of this bill and the ones that are similar in years past, they're the people who didn't have a voice 20 years ago. And so it's really time to make that right. I know that some of the opposition may be even from an organization like KDHE. And, I just want to point out that the KDHE is full of unelected bureaucrats that work for the people. It's not the other way around. And so they should not be testifying against the people. They really should be answering the questions that the people have, not testifying against us. And, because the government workers rely on continued funding, they're always going to have a propensity to testify in a way that their jobs are going to be protected. I believe that this is a conflict of interest, and they shouldn't be relied upon to give any kind of unbiased testimony. I want to share just a couple of little brief stories about a few things that I have heard personally as I've talked to people over the last few years. I know about an air traffic controller who did not want to be forced into receiving the vaccine. He did. He was perfectly healthy, and then he suddenly became so injured that he's not able to work as an air traffic controller anymore. We have a shortage of them, and so it's really a huge problem. we're taking away the ability for people to choose, and that's a huge concern. Another situation happened with the quarantine orders during the COVID era, and there was a little 8th grade girl in a small school district, and she was in a gym class and got exposed to COVID. And because she was exposed, and she was not diagnosed as COVID positive, but just being exposed, the school district ordered her to go home and stay home for 2 weeks. And her mom said, I think you can go to school. You're healthy. That was gym class. We're going to trust your immune system, and send her to school. Well, it got escalated to the point where the sheriff came to the school and said, I will trespass your daughter and arrest her if you don't get her off the property. And that's extremely unreasonable. And then my last example is that there was a baby that was born, and the mother tested positive for the bird flu. And they took the baby and would not allow her to connect with the mother. And we are having egregious government overreach when we are trying to restrict the people from making the decisions that are best for their families, for their own health, to have the choice to let their God-given immune system do their job. So with that, I will close and ask you to support SB 29. Thanks for your time.
Committee, next we have Festus Krebs. Are you in the room? Would you come forward, please? I'm sorry. Jenna was whiting my way and I didn't see you. Thank you for being here, and please continue with your testimony.
Chairwoman Gossage and members of the committee, my name is Dr. Festus Krebs III, and I spent the last week studying tuberculosis statistics from Kansas and other states. The reason I did this is because it's been used as a means of forwarding this, of combating this bill. One of the things I learned is that the United States is one of the handful of countries in the world who have the lowest statistics. Essentially, it's called eradicated. In a few countries, we're one of them. I also found out that at least 76% of patients with tubercular disease in the United States were born in another country. We all know that the U.S. just experienced the illegal migration of millions of medically unexamined persons. The press has been saying that we have a terrific outbreak of TB in the state of Kansas. I checked with the CDC. The CDC disagrees. They say this is not one of the biggest outbreaks of TB that we've seen in this country. The Centers for Disease Control. So, because of all these illegal immigrants, it's highly likely that the most new TB cases in Kansas are due to the massive influx of these immigrants who arrived with active TB infection and spread it to the citizens of Kansas. The Secretary of Health is required by law to perform epidemiological investigation into such probabilities and report to the people of Kansas. Why then are there no TB investigation results available on the Department of Health website for 2024 or 2025? Have these studies been done? We must know if these many new cases of TB were in U.S. citizens, and did the persons complete the entire 3 to 4 month course of treatment, which is generally curative. Were these persons quarantined by the Secretary if they refused to complete the course of curative medications and have a clearing medical exam? We don't know about this because it's not mentioned. If the Secretary of Health did not use the power of forced quarantine on these mostly undocumented persons who were bringing and spreading TB to the citizens of Kansas, then why would the Secretary of Health be trusted with the power of forced quarantine over our own citizens? SB 29 rectifies this problem for the citizens of Kansas. Thank you for your time.
Thank you. Committee, that concludes the oral testimony, and from the proponents, do we have questions for either of them? I'm sorry, we do not have your oral testimony. Okay, you sent a PDF, an oral testimony. I'm so sorry. I know that Suzanne was ill and she left last evening, and I'm gonna say, since or Dr. Krebs didn't get to finish, or he didn't use his full minutes, I'm gonna trust you and have you come up. We will verify. Okay, you have, I can't give you the full 8 minutes, but you would have 3 minutes. Okay. And remind me of your name. I see your name underwritten, so, but that could have been a mistake. So please continue.
Yes, ma'am. My name is Kathy Brown, and I'm an attorney at law and a nurse here in Topeka. Thank you for chairing this hearing, Senator Gossage. The testimony I sent in was talking a lot about the sort of, there's like a famous statement of Yogi Berra where he says it's deja vu all over again. We were here a couple of days ago, again, opposing the attempts of the KDHE to exercise control over we the people. The two people who just testified stated this in very, very effective terms. But I also want to mention that this bill as written is appropriately fettering the KDHE, which wants to have more and more and more power. The statements in the effect they like to have is they don't want any shoulds, they want will and must. As one lady already mentioned, we have a castle doctrine in the United States of America. Man's home is his castle. The effect that they would have, the ability they would have to come to our homes, to remove individuals from their homes, is unthinkable. Also, I want to mention, the website has had lots of things removed. Thank goodness we have now President Trump in the White House, and we have the removal of the very, very noxious DEI stuff. But the KDHE has been all over the record talking about how they want to have open borders. They consider any attempt to control illegal immigration to be quote unquote racist. The reason we have these outbreaks, I mentioned I'm a nurse. Once a nurse, always a nurse. I'm in touch with lots of nurses and doctors, and we have measles and mumps outbreaks, we do. And the reason we have it is because we have had unfettered illegal aliens coming into our country, largely from third world countries where these diseases are by no means eradicated. They are alive and well. The one senator who was mentioning TB the other day and TB today, yeah, we do have TB. In fact, we have drug-resistant TB in our country now because, again, we have people coming in from the third world bringing these diseases all over the place. I want to mention that under the last administration, Mayorkas made a point of making sure that illegals who came in here never had to submit to testing for COVID. So the statements that they make that they want to isolate, they want to quarantine, they want to have forced vax, they want to have power, they state it's because they don't want these outbreaks at all. If they did want that, if that was true, they would not be on the record as they have been with these matters.
Thank you so much, Kathy,
Thank you,
for
ma'am.
coming. Now, committee, any questions from the oral proponents? Senator Blasey.
Thank you, Madam Chair, and the question can be for any of them. I'm just looking at the bill some more, and maybe the revisor can jump in, but under current law, the County Board of Commissioners or Board of Health is authorized to make certain decisions, like apparently current law allows them to prohibit against public gatherings when necessary for the control of any infectious or contagious disease, whereas this law is taking that power away from an elected board. We've heard about bureaucrats, and I agree with that concern, but this is an elected board making those decisions who can be thrown out by the people for making a poor decisions. So in the event of tuberculosis outbreak, if an elected board of commission or health, which is the county commission, has to make a decision, what do you say about an elected board making that decision to protect the overall health of the community? Anybody who testified, they can answer that.
Is it on? As I said, for instance, we're using TB as an example here. TB is now pretty much easily cured by antibiotics and et cetera. So it's not a lethal disease as it used to be in our country. What cures these diseases, for the most part, is not antibiotics or quarantines. Has anyone here ever been quarantined? Okay. Quarantine is not what cures diseases. Okay. Everyone here has had COVID. I guarantee you. There is no way to escape it. What cures diseases is all the other factors, what the health department is supposed to do. That is, clean water, clean sewage, educating people that when you're coughing, go home and don't
Mr.
come back
Krebs,
till
I'm
you.
sorry, I'm going to interrupt. I don't think you're specifically answering his question. Am I right, Senator Blasey?
Correct.
Would you repeat the question?
So current law allows an elected board to prohibit gatherings, for example, Section 5, prohibit public gatherings when necessary for the control of any or infectious or contagious disease. And this is striking that power from an elected board. The folks who testified this morning were saying unelected bureaucrats are making these decisions, whereas this bill is taking power away from an elected board who might need to make a decision for the public good. And I just used tuberculosis as an example because it's something currently in the news. But any disease, let's say there's some disease, this bill is stripping power from an elected board. And all I heard was unelected bureaucrats. I was just curious if you could speak to that section and why that's being removed.
So each county has its own health board, is what you're talking about, right? Which is basically just the elected governors of that county. What I'm saying is the problem doesn't come up. In this country, we do it's why no one's been quarantined. They don't need the power because the people in this country, as a culture, are smart enough not to do the things that create the problems that you're talking about. So as long as the problem doesn't exist, why do they have to have the power to quarantine?
Thank you, Senator Blasey. Just one moment, Melissa, because I know you're the one who mentioned the unelected bureaucrats. I'll let you speak. But I just want to verify the wording on page 4 says the county or joint board of health or local health officer. So, Jenna, do we know, are they elected? I don't know that they're elected.
Thank you, Madam Chair. It would include both. So when it references the local health officer, that is the local health officer, but the Joint Board of Health is just another name for essentially a county commission or a city council who has the authority to, I guess under current law, order the isolation or quarantine.
And typically, is the local health officer then appointed by the commission?
They are
Is it done
appointed, but
differently in
I'm
each
not sure
county?
by whom.
All right, thank you. Melissa, if you could answer the question from Senator Blasey.
We are simply, this is Melissa Campbell, we are simply trying to line up with the CDC standards, which are to educate and to recommend. And so we're just lining up with that, simple as that.
I believe we have a question from Senator Holscher on WebEx. Go
Yes,
ahead,
thank
Senator,
you.
if you could.
My question might actually be for Suzanne. As I was looking through the list of proponents as well as opponents, I noticed Dina Hubbard is listed on both. I was just looking for clarification in terms of where her testimony should be. Oh, now I see Suzanne isn't there.
Correct, Suzanne is out ill, and so there could be mistakes on the agenda today.
Everyone, we are starting our Thank you.
Thank you.
Madam Chair, Dr. Clifford, can you hear me?
Yes, we can hear you, Dr. Clifford. Please go ahead.
I'm sorry, sorry to interrupt, Madam Chair. I have my hand raised, but I don't know if
Yes,
there's
I
an
was going to come to you next. Go right
Thank
ahead.
you, Madam Chair. I'd just like to say that from Finney County, we resolve into the Board of Public Health as a commission, but it is correct that we do delegate to hired staff to advise us and act in a public health way. Thank you.
Committee, are there any other questions? Senator Murphy.
Thank you, Madam Chair. I'm not sure who to ask, except maybe Jenna, I'm not sure. We're coming off of the COVID deal, from a few years ago. there were actions taken by elected boards, correct?
Thank you, Madam Chair. Senator, I believe so, yes.
And those were elected boards. They were done on recommendations of higher authority or whatever else like that said we need to do it. And yet we've learned since then that none of those recommendations were valid. So I guess I see the concern as being one where, excuse me, as being one where an elected board comes in and takes an action on erroneous information. And so then therefore the people's rights are trampled for no reason.
Did you have a question of anyone in particular, Senator Murphy?
Well, I asked Jenna, and I just wanted to verify
Okay.
that things had been,
All right.
this is something that has happened in recent history, yes.
Thank you. And then, Jen, I have a question for you, and then we'll go to Senator Blasey. There is nothing in this bill that affects the current tuberculosis, any ruling or any statute regarding tuberculosis, correct?
Thank you, Madam Chair. So the penalties for violating that 116A through 116M relating to tuberculosis would still be in effect, but the authority to quarantine someone with tuberculosis is something I'd have to double check if that was affected. I'll get right back to you.
Thank you. Senator Blasey.
Never mind, Madam Chair. I think in terms of the local health officer, earlier to your earlier point, I mean, if that's something that needs to be addressed, that's fine. And I certainly agree with the senator from Reno in terms of how COVID was handled. I completely disagree with how it was handled, especially when it came to schools and children. We can go down that list and rehash that for hours. But I just want to ensure that going forward, if there's an emergency of any kind, something isolated or small, that someone who's elected is making those decisions. And I thought the special session of 2020 or 2021, I thought they kind of addressed that by moving power from unelected officers to a board of commissioners. I thought was what happened. And the commission, at least in my county in Sedgwick, responded to public pressure, eventually lifting all the mandates and regulations and mask orders because they were elected, and they were responding to the people. And to my knowledge, all of them have been reelected, with the exception of one, since that incident. So I do think that's why it's important to have power or public officials who are elected and accountable to people to be making these decisions. Thank you.
All right, committee, do we have any other questions? If not, we'll move on to the oral opponent testimony. Seeing none, we will begin with, I think they're in alphabetical order, Randy Bowman. Randy, you have 4 minutes.
Good morning, Madam Chair, members of the committee. Good to see you all again. 4 minutes. I think that'll be more than sufficient.
Good.
Thank you for the opportunity to be here today. Again, my name is Randy Bowman. I'm the executive director of the Kansas Association of Local Health Departments, and apparently I have a frog in my throat, so I apologize for that. So I'll just touch on a few things in my testimony. You probably don't need all your time, but I think the crux of what we're talking about here today, and I've talked about for many years now, is we need an ability to respond in circumstances that require it. And that's not day to day. That's not every day. And the thing we lived a few years ago and we lived in 1918, those don't happen every day. But we need a means to respond. Examples used today, there are infectious diseases that occur in our communities and across time that most of us never ever hear about because they're simply taken care of. And many of those citizens who become ill work with their physician, their health officer, it's coming to that, and do things voluntarily. But simply we know as and experienced as human beings, we don't all voluntarily do the same thing. So we need mechanisms in worst case scenarios. And that's what the health department is there to do on behalf of, as you've talked today, their elected officials as the Board of County Commissioners who have the fundamental responsibility to act at the local level. And I would also add that in local government is where the action needs to happen and does happen. Be an advisor at the federal level or advisor at the state level, we can debate those things, but somebody has to take action. And that is those 3 or 5 or 7 people elected to that local county commissioner as a context I think is important. So removing those abilities to take actions when citizens won't do the right thing for the good of their communities is language we need to preserve, and this bill would undo that to the detriment of us all. Then also on administrative rules and regulations, I just was conflicted when I read that bill. It seems to be inconsistent with a lot of policy discussion I've heard around this building for decades now about regulations. This would remove the regulatory process, and KLRD has a wonderful publication that I cite in there about how that works. There are multiple elected officials and organizations, including your own legislative post-audit committee, that oversee regulations that are passed. You would remove that under this bill, and it would be under the Secretary of Health and Environment to do policies, of which there are no external oversight of policies of any organization, whether that's public or private. I don't think that's really consistent with this body's collectively work for many, many years. And then again, yeah, there's the concern that employers have, and I wanted to reiterate as well, if you're creating a cause of action here in that Section 8, that could be very detrimental, I guess would be the wording that I was looking for, to the cost of goods and services and ultimately taxpayer dollars if people start using that in ways unintended. And will everybody use it in ways unintended? Absolutely not. That's not the nature of most of us as our citizens, but there are people who would use it in unintended ways and drive up our costs, and I don't think that's something that's very advantageous either. So I'll conclude my prepared remarks there and stand for questions at the appropriate time, Madam Chair.
Thank you so much, Randy. Next, we have Timothy Graham.
Good morning, Madam Chair. Thank you for the opportunity to testify today. I'm Tim Graham. I work for the Kansas National Education Association here in the state of Kansas. You will read in here at the top of my testimony a little bit about our organization, that we represent 22,000 active members, educators in the state of Kansas, and our members come together and decide where we will stand, our position and policies on several different issues, and we certainly have a great interest in the workforce safety in schools for the teachers, and the classroom safety in our school for students. Senate Bill 29 raises some serious concerns about that workplace safety and the classroom safety for teachers, students, and their families. We feel like this bill could represent a significant setback in the fight to eradicate childhood diseases. And you can read which diseases we talk about there, and there are others. You know, the spread of infectious diseases, many of which I've listed in the paragraph before, negatively impacts public education more than any other sector, because schools are the most prevalent mass gathering establishments in our community. It's critical that we have trusted officials in place to review and implement the policies and strategies to prevent the spread of infectious diseases. By repealing the Secretary of Health and Environment's authority to take appropriate measures such as quarantine and isolation, we feel like Senate Bill 29 could lead to outbreaks that could result in chronic absenteeism, learning loss for students, and even more severe consequences. Madam Chair, I'll close by saying I understand that this is a hot topic. This has become a national debate, and rightfully so. All of us together went through a tremendous time during the pandemic, and there were a lot of mistakes that were made. There were overreach. Senator Murphy, I agree with you that there were decisions that were made that probably we could look back on it now and think, well, we didn't have to go that far. Well, let's learn from that. The knee-jerk reactions of what we all did to just stay safe and to stay alive, and because we were scared and everything else, that were all the other emotions that were involved in the pandemic were harmful at times, right? Well, let's not make the same mistake here by doing a reverse knee-jerk reaction and throwing the baby out with the bathwater, if you will. Let's keep the policies that we have in place, and let's all work together to make sure we don't get into the place we were during the pandemic ever again. Thank you for your time.
Thank you very much. And next we have Ashley Goss.
Good morning, Chair Gossage, members of the committee. I'm Ashley Goss, Deputy Secretary for Public Health. I can now do my whole testimony for 4 minutes. All right. The language in Senate Bill 29 eliminates all of KDHE's authority to require reports of infectious and contagious disease, investigate causes of disease, advise other offices of environmental hazards in public buildings, make sanitary inspections, and take action to prevent the introduction and spread of infectious or contagious disease in the state and provide public outreach service. Without without KDHE's authority to designate reportable infectious and contagious diseases in the state, healthcare providers, hospitals, and laboratories would no longer be mandated to report cases of infectious and contagious diseases to KDHE. The medical and public health community would no longer have accurate insight into whether these diseases are increasing or decreasing in our state. Additionally, as new diseases like tick-borne alpha-gal syndrome are recognized in the state, it's important that we can track the spread of this condition and provide education on providing how to prevent acquiring a disease which results in an allergy to meat and meat products with this specific disease. Foodborne illnesses or emerging infections like novel influenza will go undetected, delaying responses and enabling silent spread. Without data, we cannot allocate resources effectively, identify clusters of disease, and participate in regional preparedness activities. KDHE is currently working with other state agencies and state partners in Region 7 to prepare for the FIFA World Cup. This will bring over 1 million visitors from all over the world, not only to the U.S., but also to Kansas. We're gathering information on what the endemic and outbreak diseases are around the world with these countries, which include the Middle East Respiratory Syndrome, otherwise known as MERS, Ebola, which is currently current outbreak in Uganda, and measles, which is in currently 60 different countries. With this bill removing the requirement of mandated reporting, KDHE and local public health no longer would be able to respond to these and timely stop the infection. In 2015, South Korea had a MERS outbreak with 186 infections and 36 deaths. 36 deaths occurred, or 19% of the infections. The Sudan virus, which is also the same family of the disease of Ebola and is the current outbreak that is happening in Uganda at this time, has a fatality rate of anywhere from 41% to 100%, depending on the strain. The biggest concern, as with measles, as many of you are aware, is infants cannot receive a measles vaccine until they are 12 months of age. Without the reporting requirement, public health will not be able to quickly find those who could have been exposed to the disease and are susceptible to getting to the disease because they are not immune. Isolation and quarantine are not used for every single infectious and contagious disease or even all reportable infectious and contagious diseases. KDHE has not exercised its authority to issue legal isolation and quarantine orders in several years other than the current tuberculosis outbreak, which, yes, we have exercised an isolation orders for the current tuberculosis outbreak to keep them from sharing the disease. Most cases of reportable infectious and contagious diseases and the corresponding lab reports come directly to KDHE and not local health departments. This infrastructure that allows the transmission of this information from mandatory reporters, such as from hospital electronic health record systems, laboratory information systems electronically to KDHE, is vast, and it's not reasonable for 100 local health departments to establish the same infrastructure with mandatory reporters, not to mention the national laboratories. Should this go away, health departments would be asked to collect this information, which would create a significant ask on the local infrastructure with a significant dollar investment from each county in order to make this happen. We ask that the committee not support this bill, as it is undoing hundreds of years of public health work and has gone into preventing the spread of infectious disease. Thank you.
Perfect timing. And finally, we have William Wilk.
Good morning, Madam Chair and members of the committee. My name is William Wilk, Senior Director of Government Affairs for the Kansas Chamber of Commerce. The Kansas Chamber appreciates the opportunity to provide opponent testimony to Senate Bill 29 this morning. The main portion that I would like to focus my testimony on within the bill is Section 8. We believe this section is an unnecessary change to statutes preventing employers from deciding what they believe is best for their employees. Employers, they do not want additional burden of government regulation preventing them from working in tandem with their employees to ensure their safety and protection. Additionally, creating new civil causes of action like this one will only continue to negatively impact our legal climate. Having a negative legal climate will continue to drive up the cost of business by increasing litigation costs, increasing the cost of healthcare, and increasing the cost of insurance premiums. If we want Kansas to grow, we must have a friendly legal environment for conducting business. So in closing, we would ask the committee to amend Senate Bill 29 by striking Section 8 entirely from this bill. The Kansas Chamber believes in allowing our members to decide what they believe is best for the safety of their employees as individuals and as a united working group. Thank you for the opportunity to testify in opposition to Senate Bill 29, and I'm happy to answer any questions at the appropriate time.
Thank you, William. Committee, do we have any questions for the opponents? Senator Petty.
Thank you, Madam Chair, and I do have several, so I'll.
Let's start with two, and then we'll see if there are others, and then I can come back to you.
Okay, thank you. So my first questions are for Ashley. Ashley, you provided us a lot of information, but I'm going to go to the TB. There was a comment made during the proponents that that TB really isn't contagious, and that we really don't have a problem. Could you expand on what's currently occurring in Kansas, actually in Wyandotte County?
Ashley Goss, Deputy Secretary for KDHE. It is in fact contagious, and with this specific outbreak that is associated in Wyandotte and Johnson County, the majority of the cases are in Wyandotte County. And we have already had 2 deaths. Those deaths, and this is with regular TB, not MDR like it was referenced earlier.
I'm a state epidemiologist with the Kansas Department of Health and Environment. So I'll address food safety first. We work very closely with the Kansas Department of Health and Kansas Department of Agriculture. So they're the inspection arm for restaurants. So if there is an illness complaint that comes in, so someone calls into the KDHE epidemiology hotline, says that they ate at a restaurant and they got sick, the epidemiologist will take that information and we will work with KDA, who will go out and do the inspection. So depending on what symptoms the person is reporting, depending on what they ate, we'll try to help guide the inspection that KDA does to try to figure out what it was that might have got the person sick. If somebody calls in and just says, like, I saw a cockroach at this restaurant, then we will fill out a different complaint form, and KDA still does the inspection, but it's not a foodborne related inspection. On a larger scale, we work nationally with other state partners to track down the sources of foodborne illnesses. So think about all of those food recalls that you see. So, you know, whether it's lettuce or Brussels sprouts or whatever it might be, through epi investigation, when we interview people who have gotten sick, and we figure out what common foods they ate, and then we share that information nationally, that's how we track down the sources of those foodborne illnesses.
Thank you. Just to say, so I just want to clarify, Jen, is there anything in this bill that would change anything having to do with their investigation?
Thank you, Madam Chair. Yes. So this bill would take away the authority to issue those rules and regulations to designate diseases that are infectious or contagious in their nature. And when that is taken away, every reference in statute that says you shall, like a doctor shall report one of these infectious or contagious diseases to KDHE to investigate, there's not a list of those diseases that have to be reported anymore. So unless the legislature adopts one of those lists, then there would be no obligation on behalf of healthcare professionals to report those illnesses. Or if you got, you know, a listeria outbreak at a restaurant, you wouldn't be obligated then to report, which triggers the investigation by KDHE.
And you'll have to forgive me, Jenna, because part of my brain is thinking of the amended bill that we had last year, that a lot of those things were changed and that was put back in. So thank you. And now we'll go to Dr. Clifford on the phone, or Senator Clifford. Excuse me, on WebEx.
Thank you, Madam Chair. Can you hear me?
Yes, we can hear you.
Thank you. Just 2 points. I was a medical student at the University of Southern California in the late 80s, and half of my medical school class converted their TB tests during our 4 years of exposure. So these contact tracings, these preventive measures are quite reasonable and quite necessary. Thank you for letting me comment, Madam Chair.
Thank you. And again, Jen, if you could just clarify, there's nothing that in the bill that would change the way the tuberculosis is being handled by the department currently.
Thank you, Madam Chair. So the specific statutes related to tuberculosis are not changed. However, when the authority of KDHE and local health officers to isolate or quarantine is stripped, then there would then be a conflict in the law between the more specific and the more generalized provisions. Typically, a more specific delegation of authority, when we look to rules of construction, would be upheld. However, there would be a conflict. One statute would say you can't order quarantine, and then one would say you can order quarantine for tuberculosis. So a court would have to resolve that dispute.
And if I remember correctly, it was amended to say except for, that you may order quarantine for tuberculosis. Committee, we have time? No, we don't. All right. I'm afraid we are out of time, and this concludes our hearing on Senate Bill 29, and committee, we are adjourned.